Over a year into ZIRP, significant progress has been made.
World Bank vachishanda neWorld Food Program pamwe chete neveGO vakatibetsera kukatengwa yese material yaidiwa kuti ishande padhamu. Vanhu vakapinda basa ngevecommunity vemunharaunda muno.
239,324 people benefited through conditional and unconditional food assistance.
Takasvika pakupererwa noupenyu, vana vasikachaendi kuzvikoro, vana vedu votambudzika kana chikafu chekuti tidye tanga tochishaya, asi kubva pakazogadzirwawo dhamu redu rekumasocha, takaona taane kaupenyu katichinjira.
7,473 people benefited from the provision of agricultural inputs and livestock production inputs. Additionally, 670,256 cattle have been vaccinated in the 9 target districts.
Second time tichiwana ma-inputs akadai so zviri kutibatsira isusu especially sema-young farmers tichinge tisina pekutangira pamwe pacho mari dzema-inputs dzichitinetsa here and there but takakwanisa kuti tipiwewo ma-inputs kubva kuma-compound Ds then toyakukeni.
ZIRP has provided reprieve for 88,516 students from 134 schools.
This coming in of this ZIRP assistance helped a lot for the learners. The ZIRP also assisted us with these bags where the learners can keep and carry their books when they go to school. We are also thankful for provision of this classroom tent because of our increase in enrollment as we received more learners from other centers which were affected by the cyclone.
Technical agencies have been supported with displacement tracking data, which has helped target vulnerable internally displaced persons. ZIRP is supporting 7 mission hospitals with temporary staff to support health delivery, as well as supply of drugs and consumables.
The type of services that we offer include curative services, preventive services, health promotional services, as well as family planning services. We also provide support in building capacity for integrated disease surveillance and response in the mission facilities.
383,701 people have been reached with integrated health services and support.
Nechirwere chemudumbu nedzungu asi tarapiwa pachena pasina mare. Zvai zvakatoomera zvakanyanya kuti ukarwara kuti uende kugwenzi mare unonga usina yemota kuti ufambe kwenda kaugona ufamba.
ZIRP has strengthened programming for gender-based violence response in the target communities.
We are assisting survivors of different forms of vulnerabilities, physical abuse, emotional abuse, sexual abuse, as well as economic abuse. So we are coming in with legal aspect, where we have a lawyer. We also have a counselor. We also have the shuttle bus, which is going to be used to shuttle survivors, usually to our shelter. When they are at the shelter, they also receive counseling sessions. We also have life skills trainings there.
Mobilization for outreach clinics is done through village health workers.
Isiri kubatsirwa nemahealth worker zvakanyanya kwazvo pamusana pekuti pavana hatichaendi kumakliniki nekuti makliniki edu anogona kunge ari kure. Saka mahealth workers ari kuuya, tiri kuenda panzvimbo patiri kuenda tichisvika tichisikera vana. Saka zvinhu zviri kutibatsira zvakanyanya. Kunyazi kurwara tinoonekwa tichibatsirwa ndiwo.
Village health workers have also participated in spreading COVID-19 prevention messaging at community level.
Rubatsiro rwandiri kupa vanhu nderekubatsirana navo kuti vanhu vasanyanya kufamba kuungana pakawandiwa kunyangwe kuri kumhoresana maoko uye tichigezawo maoko edu nemvura inochururuka nesipo kana nedota.
ZIRP has now progressed into medium-term recovery interventions.
We are at the Derera gravity piped water scheme. The water source is coming from a spring. Water gravitates to storage tanks, and from the storage tanks, the water gravitates again to a network of about 6 stand points where the community gets its water from.
To ensure sustainability, ZIRP takes a step further to empower the community to manage and maintain their water resources.
Ndakandichibatsirawo ndiri ku department revaiwaka. So mukuwaka utanga tichita ndaingobatsirawo tichingobatsira semadhakabwe. So ndakakwanisa kugainawo experience.
ZIRP has trained 97 community volunteers in participatory health and hygiene education.
Mvura iyi imvura yakanaka yakatoongororwawo nana mazvikokota vekuchipatara tunoshanda navo pachipatara panyahode clinic. Saka toda kutenda kubva patakutanga kumwa mvura yakanaka iyi hatina problem yemanyoka.
ZIRP is targeting up to 9 irrigation schemes for rehabilitation.
Part of the work is to do with this storm drain, where we are employing community workers to do intensive labor activities to protect the scheme from future floods.
Labor works are currently benefiting 300 community members.
Chuya yakauya chisenza nejenda yakatipe mukana wakafanana zvekare mari yatiri kupihwa iyi takutoonawo chikafu.
Work has commenced on the 14 community access roads, which will cover up to 203 kilometers.
We are going to be installing some culverts, and what we're going to be doing, we're going to be using locally available material. The road, once we're done with it, this Nyamsundu road is going to be providing about access to 16 plus kilometers for the communities along the road.
Community workers are benefiting from the training and skills transfer.
Imba yangu yakatakurwa nemhepo ichibva yaparara yese. Zvinhu zvese zvazvirimo zvakabva zvaparara. Apa ndiri shirikadzi ndakasiwa nemurume ndine vana vaviri. Asiko zvinezvi tine veUNOPS vari kutibatsira mukati memigwagwa yedu yakaparadzwa neCyclone Idai.
Consultations have been conducted to understand the needs of the community.
The engineers, they came here concerning in the first place, mapping of the school, as they wanted to fence the school, because we've got problems with neighbors, because there is no a clear boundary to the school. So we mapped with them, and they also later came and they took some soil samples, which they will use to determine the type of buildings that must be constructed in this cyclone-prone area.
ZIRP will be supported by MAS and NLE, two of the leading African architect firms that specialize in resilient infrastructure.
Behind me there is prefabricated timber structures which were being used as classrooms by the pupils. So we're going to be putting up 3 blocks of double classrooms each, which will help decongest the school.
ZIRP continues to use an integrated and holistic strategy by combining interventions across sectors. Thanks to the World Bank and all project partners. Communities in Cyclone Idai affected areas have hope for a better tomorrow.